My name's Kelly. I'm a CBT therapist and forensic psychologist, and today I'm going to teach you a technique, and it's called VOO breathing. And if you haven't heard of it, Peter Levine's work is absolutely incredible, and it's an exercise that he regularly talks about, and it's pretty cool. It is the idea of doing some deep belly breathing, as well as focusing our attention on our breath. We are making a sound that kind of sounds like a foghorn, and it's the idea that when we exhale with the VOO sound, which is the foghorn. It can feel a little bit strange at first, but I promise once you start to practice it and you get comfortable with it, it will help to induce the feelings of calm and breath work and activating the vagus nerve at the same time. It's a win-win for me. It can be helpful if you have been through trauma, if you can find it difficult to actually calm down or just relax, and it can just be used if you are triggered or if you just need some grounding. So it can be used for a wide range of situations and for people. So before I give you a step-by-step guide of how to do it, there is actually some science behind it all, which for me, I like to hear the science because it helps things to kind of make sense and, oh, okay, this isn't just kind of some pop psychology or some fad. It's actually something that we know and research has shown as work. So firstly, we know that breathing is one of the most important things to us, and that when we are going through difficult things, often we breathe quite shallow. We breathe from our chest. We don't really breathe that deeply at all. But when we take a slow breath in through our nose and out through our mouth, we are stimulating both the sympathetic, the fight and flight response, and the parasympathetic, so the rest and digest system. So they're both the nervous systems. And this is really important for people who have been through trauma, because frequently once you've been through trauma, that you can feel on the edge, or you can feel in that constant state of that sympathetic, that hyperarousal, so that fight or flight response. So always expecting that something could happen. But even when we're stressed, we can stay in that sympathetic hyperarousal. So breathing deeply can give our brain and body that much needed break. And that is one of the elements that obviously you are working through when you are using the VOO technique. And Peter Levine was able to create this technique that was something that could actually stimulate the rest and digest, so the parasympathetic nervous system, even further. So it's not just through so always remember, we're not breathing through our chest like we do when we're feeling anxious or stressed or if we're in a traumatic situation. We're breathing through our belly. But with the VOO technique, we're also activating the vagus nerve. And with Peter Levine, in some of his books, he speaks about the trauma's stuck in the body. So the idea is, by stimulating the vagus nerve, it's another way for us to maybe induce those feelings of calmness, relaxation, and really activate that parasympathetic nervous system. So by able to bring both of those together is a fascinating way that we are able to support ourselves, but also potentially to support other people with this technique. So without further ado, let me go through how you can mix together the breathing and stimulating the vagus nerve system. So you want to sit comfortably, whether that is cross-legged or whether you've got your feet on the floor. You may want to have maybe a pillow to support your back and get yourself comfortable. And you may want to either have a low focus, so what I mean by that is just looking down, or you may want to close your eyes, or you may want to keep your eyes open, whatever you feel comfortable for. It's just, you just want to be able to pay attention to the exercise. But remember to practice this first when you are feeling relatively calm and okay, because it's much easier to respond and use these techniques when you are feeling distressed or if you're feeling anxious, once you've got an idea of actually how to use them. So, having your eyes closed, low focus, body supported, and then just notice your breath. So just take a moment, just notice how you're breathing, just settling in, just breathing in and out, just noticing how the breath cycle's going. Don't try to change it, just notice it. Breathing in and out. And out. And then, once you've done that for a little while, take a deep breath in through your nose and fill your belly with air. Breathe in as deep as you can, and make sure that you are breathing firmly into your tummy and not your chest. We want to be breathing from our tummy. So as I said, breathing in, filling up your belly, if your belly breathing, and as you breathe out, you're going to make the VOO sound, which should sound kind of like a foghorn. So you go VOO, and as long as the breath is coming out. It could be short, could be long, it doesn't matter. But what you want to do, you want to make the VOO deep enough so it allows your chest to vibrate. And some people even feel they can feel the vibration in their arms and their legs. So as long as you are try and do the VOO for at least 3 counts, but as long as you can comfortably exhale. And then once you've breathed out, you do it again. So breathe in, fill up your belly. Breathe out. As long as you can. And you can continue to do that for a couple of minutes, 3 minutes, 5 minutes, for however as many breath cycles as you feel that you need. There's no right or wrong in terms of the length of the inhales and the exhale, and there's no right or wrong for as long as you're doing it, as long as you are enjoying the breath and it is making a difference to you. So that is how you use the VOO technique, and bearing in mind that when you are practicing it, just knowing that when we do breathing exercises for 3 to 5 minutes, that's kind of enough to kind of change the oxygen levels within your blood, and that can actually make the difference to your neurochemistry. So if you are one of those people who are unsure of how long you should do it for, so aim for 3 to 5 minutes. Once you've done it, bring your focus back to the room, bring your fingers back to the body, maybe twisting, wiggling fingers and toes, opening your eyes, and going back to your day. And as I said, try it a couple of times when you are feeling relatively okay, and then when you need it, you're going to be well versed in it, and you're going to be able to use it when you really do need it. So thank you, I hope you found that helpful. Please make sure to like and subscribe and check out my other videos. Take care.